Hello guys, how are you? I'm Bean. I have a master's degree in medical surgical nursing. My subspecialty is cardiology. I'm working in health development and training center in Suleiman City. I'm glad to present my presentation in this conference. Thank you very much for everybody. Our study under the name Evaluation of the Operating Theater Staff Performance regarding surgical hand scrub at Rania Teaching Hospital. These are the names of my students, which they are researchers with me, Safia, Amina, and Balen. Hand hygiene is considered a main measure for inhibiting the risk of transmitting infection among clients and healthcare workers. In surgical process performance, performing a surgical hand scrub before putting on sterile surgeon's gloves according to guidelines of infection control is necessary. According to Center of Disease Control, a correct hand washing decreases nosocomial infection by 30%. The Guide of National Nosocomial Infection Surveillance System demonstrated that inappropriate surgical hand scrub by the surgical staff is considered the most important risk for infection after surgical process. Before entering surgical room, the theater staff should adhere the following guidelines. Wear a clean, short sleeved cotton scrub suit. Cover the underwear clothes. Trousers leg should not touch the floor to prevent transport microorganisms from place to another place. Fingernail must be short and clean to prevent puncturing the gloves and contaminating the surgical wound. All jewelry such as wedding ring, necklaces, earring, hand watching, and bracelet should be removed before starting the scrubbing procedure because the cracks and crevices in jewelry harbor microorganisms that can spread in the healthcare setting and among the patients. Objectives of the study. To describe socio-demographic characteristics of the study sample, to evaluate the operating theater staff performance regarding surgical hand scrub, to find out the level of performance regarding surgical hand scrub of the study sample. The last one, to find out the association between some socio-demographic characteristics and theater staff performance regarding surgical hand scrub. Methodology. Our study was a quantitative design, descriptive study, which was conducted at Rania Teaching Hospital in Rania City in Kurdistan region of Iraq in order to evaluate the operating theater staff performance of the surgical hand scrub. An improbability purposive sample of 49 members of the staff of the surgical staff was selected for the purpose of data collection. The content validity of the tool was determined through the panel of 7 experts. Reliability of the tool was determined through the use of the equivalence inter-rater or inter-observer approach, which was estimated 0.71. The data were collected using evaluation technique, then organized and coded into computer files. Statistical approach used for data analysis include descriptive and inferential statistical analysis, SPSS version 25. Results of the study. Table 1 talk about mean of selected variables, which start from minimum and maximum items of the study. For example, age starts from 24 and maximum age of the participant was 59 years old. Table 2 talk about socio-demographic and descriptive characteristics of the study sample, which showed that highest percentage of the participants were male, married, with sufficient economical status, graduated from Institute of Nursing, which was lived in urban area. These numbers are their percentage respectively. Also, this table was showed that 77.6% of them did not train it at all regarding surgical hand scrub. The highest years of employment of the surgical staff was 46.9%, which was between 11 to 20 years. While the most experience of the surgical staff inside operating theater room was 34.7%. This figure is talking about level of performance, which showed 71.4% of the participants demonstrated a low level of performance, while 28.6% of them had a medium level of performance regarding surgical hand scrub. Table 3 talk about evaluation of theater staff regarding surgical hand scrub. We evaluated 19 items regarding the subject, which demonstrated that the surgical staff always performed the steps of surgical scrub only in item 1, 14, and 19, but never used iGoogle, pick nail, and scrub brush because they didn't have these materials in their hospital, which we described them in items 6, 10, and 11, respectively. Table 4, talking about association between some social-demographic characteristics and performance of theater staff regarding surgical hand scrub, which showed that there is a significant association between gender, job title, and monthly income with performance of theater staff regarding surgical hand scrub at p-value less than 0.05, except age, number of training, and years of experience in the theater room at p-value greater than 0.05. Conclusion. The appropriate use of personal protective equipment is a vital tool for protecting both of patients and healthcare workers from infection. Because of that, the current study demonstrated that the surgical staff use PPE inappropriately, and 3/4 of them had low level of performance. Also, 3/4 of them were not trained at all. The study showed that there are significant association between gender, job title, and monthly income with performance of theater staff regarding surgical hand scrub at p-value less than 0.05. The age, number of training, and years of experience in the theater room showed p-value greater than 0.05. Our study recommended 3 main recommendations for Ministry of Health and Infection Control Department in the Ministry of Health to provide adequate, appropriate performance of surgical hand scrub according to guidelines of infection control. The theater staff should be participated in symposia, conferences, and workshop. The last one, finally, is recommended to conduct other studies and more studies regarding infection control by Ministry of Health Infection Control Department to focus and to pay more attention on these important issues. Thank you very much for your attention. Thank you so much for your listening. Thank you.